Ladies and gentlemen, I'm starting to see these stories on drug overdoses every week now, but it's not much going on with it in the mainstream news. So this came out on August 13th, 2020, NPR, USC's deadly drug overdose spike during pandemic, and they're still ignoring it. You know, because of COVID, you would think there wasn't much of anything else going on, but there are other things going on that's pretty deadly. So, this is one of them. So, I'm going to go ahead and play the audio to this from NPR.
New data from around the U.S. confirms drug overdoses are spiking during the coronavirus pandemic. Rural areas have been hit hard, so have Black and Latinx communities that often lack access to affordable health care and addiction treatment. NPR addiction correspondent Brian Mann reports.
I meet Jennifer Austin at a Salvation Army center in Ogdensburg. It's a working class town in upstate New York. She says the last few months have been heartbreaking.
The longer people had to isolate, it was relapse, relapse, overdose, relapse, overdose.
Austin's in recovery and works as a coach helping others. She says people like herself need structure. They need routine and support. The pandemic's quarantine rules wrecked all that. Narcotics Anonymous classes held here were canceled for weeks. When people relapse, they often wind up using street drugs that are more dangerous now. That's because of a separate trend. More dealers are lacing drugs with a deadly synthetic opioid called fentanyl.
I had a young lady reach out to me who heroin wasn't even her drug of choice. She tried it for the first time, and it wasn't heroin, it was fentanyl. She overdosed.
Data collected nationally shows this happening more often during the pandemic. Elise Alter is with an organization that tracks overdoses in real time.
We did find that the number of spike alerts and also the duration of those spikes had increased nationally since the commencement of state-mandated stay-at-home orders.
Her project, called OD Maps, found roughly an 18% increase in overdoses since COVID-19 hit, including a big spike in fatal overdoses and in more areas.
Overdose clusters had shifted from traditional centralized urban locations to adjacent and surrounding suburban and rural areas.
This is happening at a time when the rapid spread of fentanyl was already unraveling years of effort aimed at reducing overdose deaths. Admiral Brett Giroir is Assistant Secretary for the U.S. Health Department.
Basically, all the progress that we made has now been reversed, and this is even before the pandemic.
Overdose deaths were already on the rise last year, killing roughly 72,000 Americans. Speaking on a panel examining the collision of COVID-19 and the addiction crisis, Giroir said the scramble is on to prevent an even larger death toll.
Every indication we have in terms of stress, in terms of surveys about increasing use during the pandemic, basically everything is pointed in the wrong direction. It's just a nightmare.
Giroir says all these risk factors are hitting people of color especially hard.
Minorities, Native Americans, Native Alaskans, people who we know also bear a lot of the disproportionate burden of substance misuse and substance use disorders. The manifestations of our historic disparities are really just in everyone's face right now.
The American Medical Association has also raised alarms about this, about the link between COVID-19 and drug overdoses, especially in Black and Latinx communities.
This pandemic has brought into stark reality many things.
Dr. Patrice Harris, who heads the AMA's opioid task force, says racial inequities in healthcare have grown more visible as the addiction crisis and the pandemic crash into each other. She largely blames one policy decision:
a decades-long underfunding, under-resourcing of the public health infrastructure.
State and federal agencies have responded to the overdose surge, easing regulations so people in recovery have better access to medical treatments and allowing more drug counseling using telemedicine. But as the pandemic ravages the economy, addiction services and public health face even more cuts, which means for people most at risk of overdose, finding help could grow even harder. Brian Mann, NPR News.
So much for Trump's opioid task force, that was supposed to help the country get past this addiction. And I'm not surprised about the Latinx and Black, because the longer a drug epidemic goes on, you're going to have more people coming in. That actually happened during the crack epidemic. There were, towards the end, there were a lot of white people also hooked on crack. So the longer it goes on, yeah, it's going to impact other groups. Not unusual, actually more common than unusual. But y'all, this is still a huge problem. You know, many of the people that were going to rehab in this country couldn't during this pandemic because you can't social distance in those rooms. And number two, a lot of them, they were getting their treatment through the mail, and ultimately a big chunk of them ended up relapsing, and the drugs are still pouring into the country, never stopped. Even as COVID-19 was going on, it's all the drugs are still pouring in here. But y'all, please tell me what you think. You know, this addiction is really bad, and mainstream is just ignoring it big time. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.